Good day, everyone. I am Julian Patricia B. Sarmiento, and for today, I will be performing the proper procedure of assessing the skin, hair, and nails of the patient. So the goal of this procedure, the assessment should be completed without the patient experiencing anxiety or discomfort. The findings are documented, and the appropriate referral is made to the other healthcare professionals as needed for further evaluation. So, in preparation, we need to introduce ourselves and verify the client's identity and explain to the client what we are going to do, why it is necessary, and how the client can cooperate. And the next, we should perform hand hygiene, observe other appropriate infection control procedures, and then the third one is to provide for client privacy, and then most importantly is we need to inquire if client has any history of the following: pain or itching, presence and spread of any lesions, bruises, abrasions, or pigmented spots, skin problems, associated clinical signs, use of medications, lotions, or home remedies, excessively dry or moist feel to the skin, and then lastly, tendency to burst easily. So, in assessing the skin of the patient, the first thing we need to do is to inspect the skin color of the patient. We need also to consider if the patient has light or dark skin. The next thing we need to do is to inspect uniformity of the skin color. The skin of the patient should be symmetry and uniform to all parts of the body of the patient. For example, the ears, and then from the upper extremities to the lower extremities. The next thing we need to do is to assess edema, if present. So we have here the retina, the facial, upper peripheral, layer of stomach, pedal edema, and we can also identify if the patient has generalized body edema. Next, we need to observe and palpate skin moisture. The next thing we need to do is to palpate skin temperature. Note that the skin of the patient should have the normal body temperature. Note that the dorsal surface of the hand has the highest concentration of thermoreceptors and is found by many people to provide the best sense of temperature. In this procedure, we need also to note skin turgor by lifting and pitching the skin on the extremity of the patient. So the both upper extremities and lower extremities should be examined. The skin turgor is the skin's elasticity. So it is the ability of our skin to change shape and return to normal. So after performing the assessment of the skin of the patient, we can now document the findings in the client's record. So the next thing we need to do is the assessment of the hair of the patient. So first, we need also to inquire if the client has any history of the following: recent use of hair dyes, rinses, or curling or straightening preparations, recent chemotherapy, and presence of disease. The first thing we need to do is to inspect the evenness of growth and over the scalp. So the next thing we need to do is to inspect hair thickness or thinness. So I've observed that the patient doesn't have any lice in the skull and hair of the patient. So the next thing we need to do is to inspect hair texture and oilness. You can also note if the hair of the patient is falling while doing the procedure. In this procedure, we need also to note presence of infections or infestations by parting the hair in several areas and checking behind the ears and along the hairline of the neck of the patient. So the next thing we need to do is to inspect the amount of body hair of the patient. So from the head of the patient to the lower extremities of the patient. So after performing all the procedure, we can now document all the findings to the client's record. The last procedure we need to do is the assessment of the nails of the patient. So the assessment should be completed without the patient experiencing anxiety or discomfort. The findings are documented and the appropriate referral is made to other healthcare professionals as needed for further evaluation. And then also, we need to inquire if the client has any history of the following: diabetes mellitus, peripheral circulatory disease, previous injury, or any severe illness. So in assessing the nails of the patient, inspect fingernail plate shape to determine its curvature and angle, inspect fingernail texture and bed color, and inspect tissue surrounding the nails. So the last thing we need to do is to perform blanch test of capillary refill. Press 2 or more nails between your thumb and index finger. Look for blanching and return of pink color to nail bed to check for adequate oxygenation. We can also identify if the patient is having cyanosis. So it refers to a bluish purple color to the skin. It is most easily seen where the skin is thin, such as the lips, mouth, earlobes, and fingernails. Cyanosis indicates there may be decreased oxygen attached to red blood cells in the bloodstream. So after all the procedure, we can now document all the findings in the client's record. So that is the proper procedure of assessing the skin, hair, and nails of the patient. Thank you.